Today's episode has been brought to you by Schedulicity.
Welcome to episode 80 of the Connected Yoga Teacher podcast. Today is part 2 of our endometriosis 2-part series. You can listen to these 2 episodes in any order. Last week, we heard from Kimberly Costello, who is a yoga therapist who's been living with endometriosis from the age of 27. And today, we meet Dustienne Miller, a physical therapist and yoga teacher who specializes in helping women to relieve pelvic pain and increase bladder control. As usual, don't worry about taking notes. All of the notes are ready for you on our show notes page. So that's at theconnectedyogateacher.com/80. And also as a bonus, Dustienne has created a summary page where she has curated all of the helpful links that she refers to. So this is great if you want to expand your knowledge and really increase the tools so that you can help the yoga students who are dealing with endometriosis. So again, that's theconnectedyogateacher.com/80. Thank you so much, returning listeners, for being here every week. It is wonderful to connect with you. Shout out to Anita, who sent me a photo of her window installation project that was happening as she was listening to a podcast episode recently. I love it when you guys take a little screenshot and tell me what you're doing while you listen to the episode. If you're new, welcome. My name is Shannon Crow. I'm a mother of 3, a yoga teacher, and a consultant and trainer for yoga teachers. I get how isolating it can feel as a yoga teacher and as an entrepreneur. Every week, you are doing the work of learning and sharing yoga, and on top of all of that, you're running a small business. It can be overwhelming. This is why I love sharing episodes like this one today and last week, where we get to really dig in and learn about a specific health issue that our yoga students may be dealing with, in this case, endometriosis. And then along the way, also learning tips and tools to help our yoga students. The Connected Yoga Teacher podcast was created for you, the yoga teacher entrepreneur. Every week between the classes, workshops, and trainings that you are teaching or attending, you can connect to information, ideas, and a supportive community of other yoga teachers. A supportive community is so important. If you are not already a member of the Connected Yoga Teacher Facebook group, come and join us. Visit theconnectedyogateacher.com and look for the join button on our homepage or follow the links in our show notes. This is for yoga teachers all the way from just starting out in your very first yoga teacher training to someone who's teaching for over 20 years. Oh, and I wanted to tell you, I've been hearing from a lot of you who are interested in a group call hosted by me. I am working on it. Thanks for the nudge. I know it's needed. It feels like this big project that I'm really excited about, and I'm kind of looking at different ways to start and to take that first step. And it's that like fear of launching something new. So it still happens for me. I posted about it today in our Facebook group about it feeling like a big leap and looking at it instead of it being a big leap, how can I take a small step? So it's coming, you guys. I have been involved with other group calls with other entrepreneur groups, and it really helped propel my business forward. So I know how helpful it can be for a group of yoga teachers. So stay tuned. Make sure you're on our email list. That's where you'll hear more about this. Before we dive in and meet Dustienne, let's hear from our sponsor, Schedulicity.
Hey Connected Yoga Teachers, this is Ren with Schedulicity. We just wanted to take a second to thank all of you for letting us join your community and talk to you about Schedulicity. We see you taking care of each other online, and we're proud to be here to take care of you. We know setting up and switching booking platforms can be a hassle, so if you're new to Schedulicity, be sure to click the purple chat bubble on Schedulicity.com or email us at support@Schedulicity.com anytime. We'd love to set up a phone call or live chat to welcome you home.
Thank you, Schedulicity team. Alrighty, let's dive in and meet Dustienne. Dustienne Miller has a physical therapy practice based in Copley Square in Boston. She is a board-certified women's health clinical specialist, recognized by the American Board of Physical Therapy Specialties. Dustienne is also a certified yoga teacher, and she weaves yoga postures and breathing into her clinical practice. Dustienne leads a 2-day continuing education course called Yoga for Pelvic Pain. This course is facilitated through the Herman and Wallace Pelvic Rehabilitation Institute, where she also teaches other practitioners how to treat female pelvic health concerns at their 3-day course called Pelvic Floor Level 1. Dustienne danced professionally in New York City for several years, and now her love of movement remains ever present in her life. She passionately believes in the integration of physical therapy and yoga in a holistic model of care, helping individuals navigate through pelvic pain and incontinence to live a healthy and pain-free life. One other note before we dive in and meet Dustienne is that I will be here at the end of the interview to kind of share my key takeaways and to sign off. So let's dive in. Welcome to the Connected Yoga Teacher podcast, Dustienne. It's great to have you here today.
Thank you so much, Shannon.
So tell us, where did your yoga journey begin?
I first started taking yoga when I was doing musical theater back in New York. And I started out with yoga because I wanted a way to warm up before shows or before dance class. And then from there, it turned into, like a home practice, home warm up. After that, I started using yoga more as a way to integrate home programs for my physical therapy clients. And then in my physical therapy journey, I started getting into primarily pelvic health. And I really found a beautiful marriage of yoga, home programs, and physical therapy.
Wow. I'm curious, which came first, the yoga or the physical therapy? Like, when did you start school for physical therapy in relation to when you started doing yoga?
Yeah. So I started physical therapy school in 1994. I took probably my first yoga class maybe around like 99 or 2000. And then I got my teacher training out at the gorgeous Kripalu. Let's see, that would have been, my niece is 12. So probably 13 years ago.
Right.
And then then after physical therapy school, I moved to New York. I did musical theater dance professionally for a while, and I didn't do physical therapy during that time. And then I got back into physical therapy, tried to bridge and do both at the same time, and got into pelvic health. Let's see, that would be 11 years ago. So that's when I started integrating the yoga with the physical therapy.
I love that you do that. As you know, I'm a real fan of yoga for pelvic health is kind of my niche place where I love to be as a teacher. And so I'm super excited that you get to bring everything from the physical therapy yoga world and then bring the yoga in or physical therapy and yoga, and then also that you specialize in women's health. And that we get to dive in and talk about endometriosis today. So can you tell us, for those of us who don't know what endometriosis is, what is that?
Yeah. Endometriosis is really common, about 1 in 10. You'll actually see that on social media now, hashtag 1 in 10. Women and girls will suffer from pain associated with endometriosis and decreased function. And what endometriosis is it occurs when the endometrial lining that is normally inside of the uterus migrates to the outside of the uterus, and it can cover the ovaries. It can go into the vaginal area, down to the bowel. It tends to hang out between the vaginal canal and the rectum. Sometimes for people, it can cover through the peritoneum and then sometimes even up into the diaphragm. And what happens is when we menstruate, the uterine lining will shed. And this displaced endometrial tissue that is in the abdominal and pelvic cavity will become inflamed and cause scar tissue and pain. And this scar tissue will build little bridges between organs and cause adhesions. And so these adhesions will decrease the ability of the organs to slide and glide along each other and can cause restricted mobility of the nerves, of the muscles, of the viscera, and then all the connective tissue that is in the abdominal and pelvic cavity.
So when this is happening, what are some of the symptoms that someone would experience if they had endometriosis?
Yeah. So some people will experience pelvic pain. Pelvic pain could be in the vaginal area. People can have pain in the rectal area. It can be lower abdominal pain, sometimes upper abdominal pain and bloating. People might get pain at the sacroiliac joint, down the glutes, maybe into the hamstring, maybe down the leg. And sometimes that happens only during menstruation. Sometimes it flares up throughout the cycle. And then depending on how people are being treated, sometimes they may actually start to do menstrual suppression for that. But we do see a lot of comorbidities with endo. We see people will often have some form of irritable bowel syndrome or SIBO. Constipation is often part of it from the mechanical adhesions. Hip pain and back pain are super common as well.
Would someone be walking around with endometriosis and not know that they have it?
Yeah, for sure. Yeah.
So that 1 in 10 number, is that people who are diagnosed then?
That's a great point, because I did see a statistic that says up to 30. And I think that a lot of people just say, oh, it's just cramps. Everyone has cramps. We see commercials for medications for cramps. But when someone is unable to function, it is, something definitely that could be more than a, quote, normal menstrual cramp. So I agree with you. I think that it's probably an underdiagnosed statistic.
Mm-hmm. So when you say someone's not able to function, what is that person's story? I've listened to different people talk about endometriosis, and what are some of the things that you hear from them?
Yeah. Well, a lot of times people will be unable to get out of bed or get off of the couch. The pain can be really crippling. The fatigue associated with that can also be very crippling. Oftentimes people are stuck in flexion. So if you can picture like a standing child's pose, that would be like their standing posture where they're pulled down into flexion in the front and unable to stand during a flare. They might have also GI disturbances, vomiting sometimes, or constipation, diarrhea. And often these and then the fatigue, that's another part of it.
And so when you say a flare, that's when it really increases. Could it be that those symptoms last all month, or does it happen more around the time of someone's period?
It depends on how it presents in the person. Some people have severe flares that last. I've treated someone that had, it was like even after surgeries would have daily pain. So it can be anywhere from the spectrum of menstrually related. And sometimes that can also be mid-cycle for some people, depending on how it's presenting for them, or it can be daily.
Mm-hmm.
Yeah.
So in the people who I have talked to who deal with endometriosis, one of the common things that they'll say is that they look healthy, and that people think, oh, it's just your period, just, like everyone else, we all have to deal with that, suck it up, like live life. Can you speak to that aspect at all?
Yeah, it's that invisible illness, right? That reminds me also of people who suffer with other types of persistent pain, that maybe it's fibromyalgia or chronic foot pain or whatever it is, that we're often putting on our best face forward and people don't realize how much suffering they're actually having. It's challenging too when it's not predictable, because I've definitely had a lot of patients who have to limit their activities or their inability to go into work, afraid to book a trip because they may have to cancel it if they're unable to travel. So it's can be pretty debilitating.
Mm-hmm. I heard one person explain it like a slow moving cement taking over the abdominal cavity.
Yeah.
Yeah. So how is it that yoga then helps someone who is dealing with endometriosis?
Yeah. So looking the whole picture with endometriosis, we would want to look at different aspects. So I know you asked about yoga, but I'll also add in that pain management can be really helpful for people. Sometimes they use hormonal treatment. Sometimes people are having surgery, but physical therapy, manual therapy, and everything else can help. I love yoga for my patients, though, because yoga has the ability to give the person ownership of having a strategy to help in the moment. So I'm not going to be able to help someone at 1 a.m. on a Thursday night, but hopefully some strategies that we have learned in the clinic can help the person get through the flare, get through their cycle. So in terms of how yoga can help, looking at the use of pranayama throughout the whole cycle, actually, through a daily practice of pranayama can be helpful from a nervous system perspective. So if we think about the sympathetic nervous system and the parasympathetic nervous system, for people who have persistent pain, because of the stressor of pain, they are more likely to have more of the fight or flight response. So if we can work to counteract the fight or flight response, bringing the parasympathetic nervous system into more dominance, that can help with some pain control. And I tell patients, if it's like a 2 out of 10, pranayama might help you. Doing nadi shodhana or paced breathing or whatever, or letting go breaths, anything that might feel supportive. If they're in that 8 or 9 out of 10 almost emergency room pain, pranayama is probably not going to move the needle, but it is a nice strategy. So from the nervous system perspective, we can look at pranayama. We can also look at the relationship between the diaphragm and the pelvic floor. And I know you've had Kim and Shelley on who've been talking about, and Tristan was on too.
Yeah.
So this is not new to your listeners, but the idea that as you inhale, the diaphragm will physiologically descend towards the feet. And as you inhale, that descent pushes down on the abdominal organs and then causes the pelvic floor to also descend. And then when we exhale, the quote normal response is for the pelvic floor and the diaphragm to go back up. So there's this mobility throughout the day. There's a little mobility of the pelvic floor as you inhale and exhale. And you can feel it if you're palpating the pelvic floor. And unfortunately, a lot of times we get stuck if we're sitting at computers a lot in this sort of slumped position where our diaphragm is kind of cut off. So if we're not getting as much range of motion into the pelvic floor. So if we can have a more optimal sitting position, that in terms of general pelvic health for everyone, I don't care if we're talking pain or incontinence or back pain or whatever, having that more neutral sitting posture will help with diaphragmatic excursion.
I love how you brought this in. I often will get my yoga students to just sit and then put one hand where the diaphragm is and one hand a little higher than pelvic floor is, and to do this representation, of this sitting tall and then try and move the hands and then slouch right over. And it's just impossible that they can't move together the same way.
Right.
Yeah. Okay. So we get them to do that neutral pelvis aligned. And alignment, I feel like, has this different word in pelvic health than we think of it for yoga. So I don't know if you have a different way of saying like tall spine or.
Oh, yeah. That just sparked another thought. But I like the idea of length through the spine because I don't want people to feel like they have to be in a, quote, correct or if they're in a quote bad posture.
Right.
Because our pelvic floor is doing great if we're slouching on the couch. Right? I mean, it's not necessarily going to be and if I'm slouching, okay, I'm slouching right now, you can't see me. But I can still talk to you. I am, not peeing my pants. Everything is working just fine. But if we're looking at optimization, that's where we want to go into more of that neutral spine. And that being said, when we look at elite ballet dancers, they're constantly arching and contracting. And so I try to make sure that people know that it's not that we have to stay in a neutral posture, but making sure that we're not staying in a slumped posture all day.
Okay, that makes total sense. All right, I can still have my Netflix posture then.
Oh, please. Yes. There's something so luxurious about that, right? Oh, yes.
Okay, and I feel like I got you off track there when I jumped in there.
Oh yeah, no, so the pranayama is helpful from both the mechanical perspective of looking at the breath in the pelvic floor, but also from the nervous system perspective. So that aspect of yoga is brilliant. Of course, we can always enhance our lives with all of the yamas and niyamas and everything like that. But if we get it down a little bit specifically more into asana, the purpose in my mind, or the great benefit of asana for people with endometriosis or other types of pelvic pain is that a gentle yoga program can mobilize the tissues and the muscles that are attaching to both the pelvis and the thorax. So thinking about the side body, thinking about the front body and the back body and all the spiraling and rotational things, not only mobilizes the muscles, but it also mobilizes all of the fascial connections. So if we're thinking specifically about endometriosis with the adhesions, that the connective tissue is kind of bridging these little supports between the organs and kind of not allowing them to slide and glide as much as we would like, doing things like twists, gentle extensions, back bends might really help support these people.
Are there any yoga poses that feel really uncomfortable or are not helpful?
Mm-hmm. Yeah. So if someone's having a flare, or they are unable to comfortably get into extension, that tends to be the one that will flare people. I actually had someone this week that I was talking to. She was doing a yoga home program that I gave her, and she pushed a little bit further into extension than she had before, and she had a rebound pain. So what I like and what I can do is set up a link for your listeners to look at this extension progression that I have.
Mm-hmm.
And what I like to do is start people on their stomachs, and sometimes that can be enough extension. And there you breathe, and you inhale, you feel the belly coming into the mat, and you exhale, imagining that your ribs are softening and your pelvis is softening. So that might be where one starts. And then perhaps we add one knee bend, and then maybe the other knee bend, and then maybe both knees can bend, because that might actually be enough of a stretch in the lower abdomen. Maybe then we can add wipers of the feet, getting a little relative hip internal and external rotation.
Mm-hmm.
If that's okay, they can bring their feet down, come into Sphinx pose. And Sphinx pose is a really nice way to get some mobilization on the tissue that surrounds the uterus and the bladder, and also the cecum and the sigmoid. So from Sphinx, maybe that person might want to do some rib shifting side to side. And if people are tight in the lower quarter of the abdomen, this is really, really nice. So that might be good. And then if that feels good, maybe pressing up into a baby cobra before maybe they might even feel good enough to do an up dog. So that would be the progression I would take people through if they're either new to yoga or if they're also, for some people, this is a great way to rehab from disc herniation or any sort of extension, if extension is helpful for their back injury.
Mm-hmm. And so you had said if someone is at kind of a 2 out of 10 pain level, then you could tell them that pranayama would make a difference. Is there a pain level that you would say, you know what, don't try yoga right now, you need to find something else? Or
Yeah, that's a great question. I love letting people guide themselves because I really do believe that we know if we get quiet and we really listen, we know what's right for us and what's wrong for us. So unless that person I can tell has no ability to kind of pull back, right? So if I'll tell people, if this feels good, and that's how when I'm teaching group classes, I'll say, and if this feels good, why don't you see if you would like to try this? So for people going home with that extension progression, they could say, okay, if this felt good, the wipers felt good, so let me go into Cobra, or let me go into Sphinx next. In terms of pain, I would say anything that causes an increase in pain, I wouldn't want them to do because I'm a really conservative person in terms of like physical therapy. So I would rather people not push the edge, which is very contrary to what a lot of your listeners might also believe. But I tend to, like I said, be conservative. I'd rather people not push because sometimes pulling back, practicing more mindfulness, softening into postures instead of pushing into full end range can help people with persistent pain. And that's a whole other topic, which I would love to talk about someday, is the idea of retraining the brain to not expect movement to be painful.
Right. It reminds me of, it's always when I work with yoga teachers, this happens. You know, you see people going, or they're just like, what am I supposed to be feeling in this pose? And I'm like, nothing.
Yeah, I love that.
Or I say to them, I see you're all being great A students. Let's try and be a B or a C student now.
Yes. Oh, I love that. I remember one day when I was teaching, I probably had about 8 people in class. They were all in a different posture. And I thought, wow, this is the greatest teaching moment. The fact that everyone is listening to their bodies and doing what feels right in their body.
Mm-hmm. Right? Oh, I love that.
Isn't that great?
I love it when everybody does something different. And I know sometimes that can stress teachers out, but I love it if I can look around and see all kinds of variations of what's happening. Yeah.
Oh, it's a total mic drop moment. You're like, nailed it. And you guys don't need me anymore. I'm going to go check out some Netflix shows.
Is there anything else that you can think that's helpful for the person who's dealing with endometriosis in terms of a yoga class or the teacher that's supporting someone?
Yeah, I think that so I talked about extension, which is probably going to be the most challenging direction for some people, meaning that usually, so I mentioned that when people have pain, they go into that flexed pose. It's actually something called the viscerosomatic reflex, when there's visceral pain that the body takes on a different shape. So knowing that child's pose can be really restorative for people. So for people during a flare-up, or if they're laying in bed or on the couch and they want to work in a restorative posture, creating child's pose in side lying with some pillows, or creating a restorative child pose in the bed can be a nice way to say, okay, I'm going to do some mindfulness meditation here, or I'm going to do some pranayama here for 5 minutes, see if I can continue to soften through the sacrum, soften at the hips, and use that moment for working on resiliency. So I like that. I like a restorative goddess pose. That can be really grounding, especially with sandbags.
And where are you laying on your back then?
So for the reclined goddess, I would have the bolster along my back lengthwise. I would have the block on its highest height, and that's at the head of the bolster.
Okay.
And then you can have your legs straight out, or you could have your soles of your feet together with the knees out, and then blankets underneath the knees. A blanket over the pelvis can feel really supportive. And then I love Tara Brach. So if I'm doing restorative postures, I usually put on a Tara Brach talk or a Tara Brach meditation. And
I don't know what Tara Brach is.
Oh, I love her so much. So TaraBrach.com. I've had the pleasure of going to her workshops, and she is divine. I hope you can check out her talks. She's really nice Dharma talks, and she has beautiful guided meditations.
Okay.
Beautiful body scans. Really great stuff.
Okay.
Yeah.
I'm going to put a link in our show notes, and I'm going to look it up as well.
Oh, that's great. Yeah. Yeah. So front of the body, we talked about that. We talked about some restorative stuff. I would say the side body is really helpful too. So again, if we're thinking of somebody who might be wanting to do a little bit of movement, but they're not feeling like they want to go to a whole class, maybe they do like a banana pose where you're laying on your back. You can do this in bed with your feet to one side and your hands and shoulders to the same side. So you're in that C shape. Or a standing half moon is nice for the Kripalu version of half moon is when you're standing in mountain pose and you go to the side. So that would be good. And then any rotations, twists, like a supine twist, that would be really great to get some of that myofascial release across the abdomen, open up the chest. Anything we can do to enhance rotation through the spine would be great.
Okay. What about something like supported bridge with a block in the sacrum? Yeah.
Supportive bridge could be great. Supportive bridge I love that actually for prolapse.
Mm-hmm.
Yeah, which I'm sure I know you know. We're trying to stay on topic, but it's really hard to. Supportive bridge might be okay. It might be a little intense for this SI area, for the sacrum, for people who might be having pain there, because very often people will have pain in through the sacroiliac joint and sometimes even pain to palpation. So it might be a little too much pressure to be in that pose. And then if they're actively menstruating, that may not really feel supportive. They may prefer something more like a goddess pose.
Right. Okay, I love that. Where there's like a slight elevation, but the spine is on the same level. Do you have a photo of that reclined goddess pose?
I sure do, and I can send it to you.
Okay, that'd be great.
Yeah.
That's the only tricky thing we have with podcasting. You can take us on the go, but you can't see us.
I know. And I like legs up at the wall. You're having me think with the supportive bridge. Of course, legs up the wall can be super supportive with the strap around the knees, right? Just above the knees. If there's someone else to help, maybe a little sandbag on the feet to ground through the legs.
Mm-hmm.
Yeah. Restorative is a beautiful option for people. And I like to remind people that it is real yoga, because sometimes people think if I'm not wearing yoga pants and I'm not in a yoga studio, it's not yoga. But as you know, there are many forms of physical postures or many forms of yoga. There's many ways to, quote, do yoga that does not look like your typical asana flow.
Mm-hmm. And the asana is just within like hundreds of years that we've learned that. And the philosophy of yoga is thousands of years old. So,
amen, sister.
Yeah, I feel like that's always the missing piece.
I know. Right.
Is there anything else when you're wearing your hat as a physical therapist? Is there anything that you feel like this is generally helpful for someone who has endometriosis? I know it's very individual.
That is a great question. Anything I would want? Well, I think just using this opportunity to increase awareness about the fact that menstrual cramps shouldn't disable somebody and that there is help out there for people. Very often, I don't know if I've ever seen someone I've treated for endometriosis who hasn't had a pelvic floor issue along with it. So very often releasing restricted tissue in the pelvic floor muscles is going to be part of a treatment plan, and that can help. And people can do home self-treats. I love awareness. I have a breath cues chart that I give people that helps you visualize what the pelvic floor is naturally doing when you inhale. And using bony landmarks, because sometimes it's kind of ethereal. If we think we know how to make our biceps contract, but we don't always know how to make our pelvic floor contract or pelvic floor release. So I can also, we'll curate a list for your listeners.
That'd be amazing.
Yeah. And we'll get all the info. Yeah. So I think that if people can use the imagery, use the mindfulness moment when there's a stab of pain, reconditioning the brain to say, okay, every time I feel this pain, I'm going to see where else I can soften on my body. Can I soften in the pelvic floor? Can I soften my lower abdomen? We're often walking around with our abdominal muscles really tight, either because of how we want to perceive ourselves in the mirror, or because that is our default sympathetic nervous system fight or flight response. So softening the belly when we're sitting, softening consciously at the end of the day, maybe being in tabletop and letting the belly hang and release, and all of that can be supportive for people.
Okay, that's fantastic. In terms of where do you typically refer someone? So if they are doing some yoga for their endometriosis and they're seeing a pelvic floor physiotherapist, who do you tell them to see in terms of their? Because I know a lot of people say like surgery is really the only way that this can that my treatment has been effective.
Yeah, thanks for bringing that back around. I love acupuncture for that. I love the fact that someone can be treated holistically through the whole energy system with acupuncture. Diet has really helped a lot of people looking at specific things. A lot of people find that if they take dairy out, that is a little inflammatory for them, limiting sugars and alcohol. Sometimes people will take gluten out or look at maybe doing a food elimination to see if symptoms are better. Taking certain things out, like not using plastics for their water and their food, eliminating the environmental excess estrogen sources, looking at pain management. So that could be maybe someone gets different creams or injections or patches. That's another option. That is a non-surgical option. Some urogynecologists, urologists, and gynecologists will do also different trigger point injections, maybe Botox to the pelvic floor if that seems to be a pain generator for people. What am I missing? Sometimes people will use essential oils or castor oil with heated for the abdomen. And I recommend, I usually try to give people as many ideas as possible, see if any of them intuitively feel right for them, and then have them explore that if it is their desire.
Have you heard also of the Epsom salt bath with the magnesium? Yeah.
Yeah. Yep.
And then so am I correct in that endometriosis is only diagnosed with a laparoscopic surgery?
Sometimes people will do the pelvic ultrasound, so like the transvaginal ultrasound. And it's my understanding that they can sometimes see it. I think the gold standard for diagnostics, though, is to actually physically get in there and look at the implants with the surgery. And what they're doing now is they're going in, if you can picture like a weed in the ground, they're going in, instead of just taking the weed out, they're going in and excising through underneath the root and then getting it out. But they're finding that people are embryologically, that endometriosis is present. So the question is, when does it develop? Why does it develop? And I think we're a pretty far way off from really getting a handle on more treatment options for people. Yeah. Sometimes people will be, they'll do the continuous birth control, like I mentioned. Sometimes they'll try progesterone. Sometimes they'll do something called Lupron, which basically is like forcing you into menopause. And all these things have side effects. So it's not like, oh, great, I'm going to do this now and I'll be okay. It's still a real challenge for people. And a lot of times changing the lifestyle can really be helpful in terms of decreasing cortisol, increasing sleep, looking at a cleaner diet. But all that stuff is hard. It's hard to do.
It's not just snap your fingers and it's
No.
Well, that's pretty fascinating how you said that it is there from when we're an embryo.
Isn't that wild? Yeah, that's the newer research. They're seeing that it's that we're born with it. Yeah.
Wow. Well, that makes sense because they say that there's a real genetic component. That's why a lot of women will say, well, my mom had cramps and I have cramps. And it's just the way women, it's just a thing. It's just what women have to deal with, but it actually isn't.
Yeah.
I think for a while I didn't understand what endometriosis was. I had different friends that had said that they had it, and I didn't understand that it's actual tissue like coming outside of the uterus and like you said, attaching and growing onto different organs. That once we have that visual in mind, it puts it on a whole different level.
Yeah. It's a lot more debilitating, I think, than people realize. And it's not talked about in the same way, just like all the pelvic health things, as you know. If you have, my nephew just broke his distal radius, as he likes to tell us. So that's really obvious that he's wearing a cast. Everyone's going to say what happened to you. But if you walk into work and you're feeling like you're going to throw up and you're feeling like you're totally fatigued, someone might think you're just, a little cranky. And maybe you're accidentally short with someone or don't smile, and they may have no idea what's going on, that you're just trying to push through your day. So it's tricky. But the awareness is out there. There's a huge social media campaign. It was back a couple months ago. So I think next year we'll see even more awareness.
Well, that is really positive. Anything else that you would say to yoga teachers who are working with those who have endometriosis or those yoga practitioners that are dealing with that pain?
Probably coming back to the idea of listening to your intuition. So if in allowing the student to know that it's okay to not push, in fact, they might have a better experience if they don't push. That's my perspective.
That's good. It's a really good one. All across the board in all classes, I think that's, yeah. Well, thank you so much for your time today. It's been very enlightening. I've learned a lot.
Oh, it was an absolute pleasure. Thank you so much.
Alrighty, connected yoga teachers. I'm curious to hear what your key takeaways were. I'm definitely going to share mine with you now, but feel free to message me or leave a comment in the show notes. Huge thanks, Dustienne. This was a lot of information. I got looking at the hashtag 1 in 10 that you had said, and I feel like there are so many more resources and a lot more information out there as well. So thank you for sharing that. I would definitely suggest to people to look up that hashtag 1 in 10. I really appreciate how Dustienne talked about how the parasympathetic nervous system, how we want to look at making it more dominant, and that sometimes pranayama isn't the key that we can use. And this is really something to turn to if pain isn't too intense. Also, Dustienne brought in this awareness of trying to avoid slump postures all of the time, but also letting go that sometimes we are in more of a slump posture. So if you even think about cat-cow pose, and then if we're doing seated cat-cow, it's kind of like we're slumping over, slumping forward. And it's just a movement of the spine. And it's been making me think a little bit more about movement, not trying to always be sitting tall, but also bringing that in. So just thinking about sitting tall, tall spine makes me do it. And I like how Dustienne brought in that the pelvic floor and the diaphragm have this natural mobility during the day, and it's happening. So thank you for that. Also, huge shout out of thanks to Dustienne for bringing in the yamas and niyamas. So we have just covered the 8 limbs. If you haven't heard those 2 episodes to dive into the 8 limbs, I highly suggest it. I know I've heard from so many of you who really were thankful for these 2 episodes, and I'll link to those in our show notes. So on top of using the yamas, the niyamas, and pranayama as part of that, we get into some of the asana, some of the postures or shapes that Dustienne said that she will turn to. So she said gentle asana, anything that's mobilizing tissues, getting into the fascial connections and the muscles, and really getting into that adhesion of connective tissue so that we're moving towards more of a slide and glide. And I feel like this is one of the benefits that yoga really offers to us. In terms of that, Dustienne also talked about how extensions can be the movement that can cause a flare, and that she has an extension progression link. So I'm super excited to link to that. Also, child's pose for a flare. So that can be from the couch or the bed and even inside lying. So that's something I hadn't thought about. And this is something I would like to bring into my yoga classes as an alternative, as a modification or a variation of child's pose to do it side lying. I wonder if any of you have tried that. Other asanas that Dustienne talked about was restorative goddess with sandbags, and also banana pose or standing half moon. That's what we would call it from the Kripalu version of things, where we're getting into the side body. A supine twist that focuses on opening the abdomen and the chest. A spinal rotation, legs up the wall, and especially if we bring a strap above the knees and sandbag on the feet. And then also anything restorative yoga. In today's interview with Dustienne, she said, there are many ways to do yoga. You don't have to be in a studio or in yoga clothes. And I think this is something that I keep looking at, that yoga happens on and off the mat. And sometimes what I need is just to step away from my desk, take a few stretches, focus on my breath. And it doesn't mean that I'm all dressed up for yoga and in a studio and in a full hour-long practice, that I can weave it into my daytime routine. So maybe you'd like to pause the podcast right now, or maybe you just want to move along while we close out the end of the podcast and find some breath and find some delicious movement. Also, one last key takeaway, and I have to share a personal story in this. I work at a physiotherapy office in Owen Sound, Ontario. Some of you have heard me talk about this, and I think that there's such an important piece here. I love being able to refer people to others in the office, say a massage therapist or a physio who's going to help them out more. And so I would say to anyone dealing with endometriosis, pelvic pain, any issue, and to really offer this to our students who are dealing with a health issue, is to curate your team. So really look at how can you curate your team. Do you have a physio working with you? Are you working with a yoga teacher who specializes in what you have going on? Do you have someone who helps you with pain management, maybe acupuncture, a nutritionist, sometimes essential oils? And Dustienne talked about how all of these people can be helpful for someone dealing with endometriosis. So this was a key takeaway for sure. And I see this having such an impact on the people that I work with, in that I'm part of a team and I know when to reach out to someone else on the team when it's out of my scope of practice. If you are wanting to get together in person, I'm teaching very soon Yoga for Pelvic Health. It's a 20-hour yoga teacher training, September 22nd and 23rd, 2018 in Meaford, Ontario. This is 20 hours. There's a comprehensive manual. We go through many yoga flows. It is an amazing training. I've heard from many of you who are using it, and it's super exciting to hear that ripple going out into the community. Also, there's an 8-hour online training. If you can't make the in-person training, you can find all of that information on the connectedyogateacher.com. Go to trainings and events for more information. If you want to work one-on-one with me in a consultation call, visit theconnectedyogateacher.com and look for Work with Shannon at the top. Lately, some of you have been reaching out to me to book a one-on-one specific call just around yoga for pelvic health, especially if you've taken the in-person or online training. And I think this is a fantastic way to kind of expand your knowledge and to ask more questions, to continue to learn. And so that's also an option. You just reach out to me via email. It's Shannon at theconnectedyogateacher.com, and I'll let you know how to do that. If you have enjoyed today's episode, press pause now and leave us a review on iTunes. If you're not sure how to do that, go to the show notes page. It's super easy. theconnectedyogateacher.com/80. Look at the buttons at the top. Thank you, Kathleen Pratt from Canada. Kathleen left a review for us. She said, as a new yoga teacher, I've found a wealth of information to help me start up my business and explore yoga practice and concepts. Shannon is an exemplary role model, giving freely of her talents, knowledge, and encouragement. The podcast led me to the Connected Yoga Teacher Facebook group, which provides a community for yoga teachers and teachers in training. I'm sure I'll still be listening to and learning from this podcast in the future. Thank you, Shannon, and the Connected Yoga Teacher team for your visionary approach. Thank you, Kathleen. It's so great to hear from you, and I'm super excited to hear how you are taking yoga out into your community. I also heard from Yale, and I hope I'm saying your name right, Yale, because we've only been talking over email. Yale is taking the online pelvic health course and says, I wanted to thank you so much for this online course. With my busy schedule, it's hard for me to get to in-person trainings, and these easily accessible video links were perfect for me. Also, your teaching skills are amazing, so clear, and you make the material interesting and relatable, so I appreciate that. I'm super excited to bring this into my classes, especially because I'm starting to teach in my pelvic floor physical therapist's office. I definitely feel confident to start bringing the material in. Thank you so much, Yale. I love how you're starting to work in a physical therapist's office. That is exciting times, and it makes me really happy to hear that you feel confident with the material. Today's episode is possible because of our fantastic team over here. Thank you, Laura, Samantha, and Suzanne for making this happen. Okay, Connected Yoga Teachers, huge thanks to you as well. We are a podcast because you are a listener. Have an amazing week. Stay connected to self, to your practice, and to your community so that you can share the yoga that lights you up.